Thank you for tuning into Well Said for expert discussion and insight on health and wellness topics important to you. Well Said is a collaboration between the Donald and Barbara Zucker School of Medicine at Hofstra Northwell and WRHU Radio Hofstra University. Join us today and each week for your recommended dose of Well Said with your host, Dr. Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today, we'll be discussing tick-borne illnesses. That is, any disease that is transmitted by ticks. Summertime for many means more time enjoying the outdoors, but it also means more encounters with these tiny critters that can make us sick. As we'll discuss, tick-borne illnesses are pretty common. According to a CDC estimate, more than 470,000 cases of the most common tick-borne disease in the United States, that is Lyme disease, are diagnosed each year. But as we'll discuss, Lyme is not the only important illness tied to ticks. To educate us on all of this, I'm delighted to have on the show my colleague, Dr. Marta Feldmesser. Dr. Feldmesser is the Chief of Infectious Diseases at Lenox Hill Hospital in New York, and I'm delighted she's with us today. Marta, welcome to Well Said.
Thank you. Thank you very much for the invitation.
So you're an infectious disease specialist, and we've been in the middle of a global pandemic for the last 2.5 years. So how are you?
I'm doing great. I mean, the IT world is busy with all kinds of things. We have one interesting happening after another as we move through monkeypox. I can tell you that my colleagues and I are never bored.
Yeah, I can imagine. Maybe we'll have you back to talk about monkeypox, but today we're talking about tick-borne illnesses. So let's start with some very basic information for our listeners. What are ticks, and how is it that they transmit illnesses to people?
Ticks are tiny parasites. Parasites are organisms that live in or on another organism and get nutrients at the other organism's expense. In the case of ticks, they live by feeding on blood of animals, and there are a large number of different tick species, and each of them have their animals that they prefer to feed on. So the diseases that are spread by ticks basically live in the salivary gland of the tick, so that when the tick feeds, it gets injected into the animal that's bitten through the tick's saliva.
So it's not really the tick that's making us sick, it's something that's living inside the tick, a bacteria or a virus, or what is it that they're transmitting?
So they can transmit bacteria, viruses, and also other parasites.
You said these are small. How small are they?
They range, depending upon the stage of life, from a millimeter to a few millimeters. You generally don't see any that are larger than a centimeter.
So a millimeter, just for reference, we're talking like the head of a pin here, right?
Exactly. Thank you for that, Ira.
When you say that different stages of life, you're talking about the life cycle of a tick.
Yes. So they go from sort of an egg stage to what's called the nymph stage. They go through a variety of different changes before they become adults. And actually, the nymph stage is very important in terms of the spread of Lyme in the environment. So when you talk about which animal species the bacteria that causes Lyme likes, these ticks feed on mice as well as deer. Okay, so it's the deer tick, it's the Ixodes scapularis tick that transmits Lyme disease. And the nymphs not only like deer, but they like white-footed mice. The nymphs play a very important role in terms of transmission to humans as a result of that.
What stage of the tick is the one that attacks or bites a person?
So it can be both the adult or the nymph.
And for a tick to transmit a disease to a person, does it necessarily have to have previously fed off of a deer or a rodent or some other animal?
Generally, yes. So the bacteria is in the environment, and that's how the ticks pick it up, by feeding. And so they feed it, and then they go on, once they're infected, they go on to infect whatever other animal they attach to, whether it's a human or a deer or et cetera.
We're blaming the tick, but the tick is really just a means of transmission of the disease that would ordinarily reside in a deer or a rat or some other animal in the environment.
We call them vectors.
Okay. So you mentioned Lyme disease, and I'm sure most of our listeners have heard of Lyme disease. So let's talk about that in particular. So how do you get it, and what's it like to get it? What do people experience with Lyme disease?
So again, the bacteria that causes Lyme is called Borrelia burgdorferi. For the tick to transmit it to a human, the tick has to be attached for at least 24 hours. That's actually very important, so that if you know you've just been bitten and it's just there and the tick is not engorged, so enlarged with your blood, then you can pretty much know that you're not going to get Lyme from that particular bite. So the tick needs to be there. And then the incubation period. So the time from the bite until you get sick is, with the early stages of Lyme disease, generally ranges from 3 to 30 days. Most commonly, it's around a week, but it can be shorter or longer. And the first thing that you see in localized Lyme disease is typically at the site of the bite, although many people don't know that they had had a bite ever. The first thing that they see is a rash. And so this starts as a red patch that then enlarges. And so there's sort of a classic picture for Lyme disease, for the rash that causes Lyme disease, where what happens is as the redness spreads outward, there's an area of clearing further inward toward the bite. So we call it a bullseye lesion or a target lesion. That's kind of what it looks like. So that's early Lyme disease. It can itch, it can burn, it can be painful. And around that time, you can also have sort of generalized fatigue, headache, fever, chills, or swollen glands around the area of the bite. But not everybody gets these symptoms of fever, et cetera. So if you see the rash, pay attention. The disease is caused by ticks. A lot of them go in stages. So the second stage of Lyme is one that results from spread of the bacteria throughout the person's body. So if you don't treat the localized Lyme disease, it can spread and it can go to a number of different organs. So then again, people can get multiple rashes around that time, body aches, muscle aches. Two of the places that it likes to lodge are what we call the central nervous system. Probably the most common neurologic thing that we see. So it's not only the central nervous system, it's also the peripheral nervous system. But one of the most common things that we see is a facial palsy. So Bell's palsy, for example.
A paralysis on one side of the face.
Right, exactly. So it can do that, or it can cause paralysis in one nerve in other places. It can also cause meningitis. So when meningitis, people get fever and a headache, a very severe headache, and their neck may be stiff and light may bother their eyes, et cetera.
But just to interrupt you for a second, so this is in people who didn't get treatment early on?
Yes, exactly.
Okay. So all of these things would occur kind of weeks later if they didn't seek or get treatment for the initial rash and the earlier symptoms that you described.
Exactly. And I think, one of the major take homes of this is to pay attention. Pay attention to fevers, pay attention to symptoms, et cetera, and don't assume that they're nothing or, that you're fine and they're just going to go away by themselves, because though they may ultimately just go away by themselves, they may result in something down the road that's more severe and serious than you would have wanted it to be otherwise.
And so let's just carry that forward a little bit. So if, again, this is untreated in the early stages, and then you get to this later stage where it can attack the nerves or other organs in the body, what's the left untreated forever? What's the natural history of untreated Lyme disease?
Okay, so, and again, it's not in everybody, all right? So there are people where it does go away completely, okay? And so like the neurologic things are in something like 15% of untreated people. It's not everybody, okay? So then the next thing that we see, in addition to the neurologic, is cardiac manifestations, so the heart. And there, the sort of most famous thing that it causes is what we call, it's a rhythm disturbance that we call heart block. And that can range from very mild to something that causes you to pass out, where you really need immediate medical attention. Actually, as an infectious disease physician, treating those people is very rewarding because if you give them just some antibiotic, it goes away completely, and they don't even need a pacemaker. I mean, it just goes completely.
Right. Well, as a cardiologist, I've seen a couple of patients who have had heart block from Lyme disease, and as you say, the challenge there is making the diagnosis so that you don't put in a pacemaker and you treat their Lyme disease and their heart gets better and they don't need a pacemaker. So let's go back to the earlier stages of this. So there are a couple of things that you said that I found really intriguing that seem important for us to clarify. The first is that the tick has to be in place for a long time, like a whole day, 24 hours, before you're really at risk for the transmission of the bacteria from the tick to the individual. My interpretation of that is if you're looking for ticks every day, if you're out in an area where you might be exposed and you get them off within hours of when you may have been bitten, then you're in pretty good shape. Is that correct?
That's absolutely correct. And part of the key to prevention of tick-borne diseases is to do frequent tick checks, not only on the people in your world, but also on your companion animals, because both cats and dogs can also carry ticks.
And is that sort of 24-hour rule, roughly, does that apply to other tick-borne illnesses, or is that unique to Lyme disease?
So it's unique to Lyme disease. Some of the other diseases that we can talk about may be transmitted sooner within that 24-hour window.
Yeah. So let's go back to the early stages of Lyme disease. So you said that it incubates, meaning it makes itself manifest in most people within a few days of the exposure. What is the treatment and how effective is it at getting rid of the infection at that early stage?
It's extremely effective. So we have several antibiotics that treat Lyme. The hallmark one that you hear people that we use most commonly because its efficacy is the best is doxycycline. And it's generally, for early Lyme, it's like a 10-day course of doxycycline and you're done. That's it. There are other antibiotics doxycycline is not great in children. It's not great in pregnant women, really mainly because it stains teeth. But we have other options for Lyme, including amoxicillin and a related antibiotic called cefuroxime.
Again, if most people recognize that they've had a tick bite, get treatment early on, almost everybody does well, is what you're saying.
Yes.
So why do we hear so many of these stories about people who were treated for Lyme disease and then seem to have some post-treatment debilitating kind of Lyme syndrome? I don't even know what to call it. That seems to be, controversial.
No, it is controversial. It's very controversial. Before we go there, though, there's one other manifestation in the course, which is the latest manifestation of Lyme that we see is arthritis. Okay, that is an inflammatory condition. It causes inflammation, swelling, generally in large joints, most commonly the knee. That can actually be relatively difficult to treat. So the further you go along the spectrum, the harder it gets to treat. Okay.
Okay, good. Well, thank you for adding that.
So I just wanted to put that there because when people, so the controversy with post-Lyme goes as follows. And here I actually have to thank COVID a little bit because we know that there are a whole host of post-infectious inflammatory syndromes that make people feel awful. And so you keep hearing about all of the long COVID syndromes, et cetera. And that has helped me, I've been able to take that back to some of my patients who think that they have chronic Lyme and say, hey, it's not that these people still have COVID and active infection, but it's, sort of the remnants of it. Okay.
Interesting.
Yeah, because a lot of the disease is due to the inflammatory response. That's true of COVID as well, right? So there are kind of two groups of people who have really had Lyme and who have had, feeling awful post-Lyme, and it's usually a later stage than just, a little bit of a rash. But there are also a group of people who have at some point been told that they have Lyme or think that they have Lyme, who have no objective findings of actual Lyme disease. And what has happened is that there is a community of physicians who have sort of tapped into these populations and have fostered the notion that it's related to ongoing active infection that needs treatment with antibiotics. And they will frequently prescribe repeated, prolonged courses of intravenous antibiotics, which is, that have not been shown to help with these symptoms, obviously can be harmful. And it's a community that calls itself Lyme literate. There's a lot online. It's one of these situations where you have to be careful what you read.
Yeah, wow. Without wading too deep into those waters, I mean, it sounds like what you're saying is there's not a lot of scientific evidence to support the notion of chronic Lyme infection, but more that these are folks who, in most cases, probably did have Lyme, but now still kind of feel crummy as a consequence of that, but will hopefully get better over time without antibiotics.
Exactly.
Is that fair to say?
Exactly. And it becomes very hard sometimes because, after the 10th course of antibiotics, if they're feeling better, they attribute it to the antibiotics when it may just be tincture of time.
Yeah, that's always a difficult conversation to have. So let's move away from Lyme disease because that's clearly not the only tick-borne illness. So educate us a little bit about some other ones, especially ones that people might reasonably expect to encounter in the Northeast.
The most common ones that are spread by the same tick as Lyme disease are called Anaplasma and Ehrlichia, and these are both bacteria that can cause very nonspecific symptoms. Most typically, they cause fever, fatigue, body aches, etc. But they can also cause some GI symptoms such as nausea, vomiting, diarrhea, loss of appetite. They can sometimes cause confusion. But for these diseases, a rash is actually very rare. And so the range of severity is can be just very mild or can be very severe. The good thing is that those are also treated by doxycycline, so that when you treat for Lyme, you're also treating for Anaplasma and Ehrlichia automatically. The next most common thing that we see, particularly common on Eastern Long Island, is Babesia. So Babesia is a parasite that lives in a parasite, and basically it causes the hallmark of the disease caused by Babesia is high fever. So fever is up to like 105, and so this generally is from 1 to 6 weeks after the tick bite. People who are immunocompromised, so who don't have normal immune systems. So people who are elderly, people who don't have a spleen, people with cancer or who have HIV can get very, very severe disease from this. And it can be pretty scary. But in general, for people who are whose immune system is normal, they get fatigue, weakness, malaise, and then can get neck stiffness, sore throat, shortness of breath, etc. And people can develop both liver and kidney failure in relation to Babesia. So it needs to be treated pretty aggressively. The good news is that, again, we have antibiotics for this. In this case, it's 2 different antibiotics. One that we use very commonly called azithromycin, that's in a Z-Pack that people may have heard about. And the other one is a drug called atovaquone that we use for a range of parasitic diseases.
Are there specific tests for each of these things? Like if somebody shows up in their doctor's office and is in an area or has engaged in an activity where they may have been exposed to a tick and has a febrile illness, it sounds like there are lots of different things that could have caused that. Are there specific tests that the doctor can do to say, oh, well, you have babesiosis or you have Lyme disease or you have ehrlichiosis, or, I mean, how does that go?
So if you give me, so yes, we do have testing, but if you give me my wish list for research for the future, it's exactly here. It's in diagnostic testing. So a lot of what we use for testing, and we do have specific tests for each of these, but for Lyme, Anaplasma, and Ehrlichia, we rely on antibody testing. So you pretty much have to treat upfront without knowing for sure. And there are blood tests that we do. So for example, white blood cells, which are cells that fight infection, are typically low, and platelet counts, which, platelets are cells that help us clot. Those are typically low with Anaplasma and Ehrlichia, not so with Lyme. So a lot of the time, for those 3 diseases, we end up treating because we think that's what it is. And because we rely on antibody testing, and antibodies aren't made until generally 4 weeks, 2 to 4 weeks after infection, after acute infection. So you can't, rely on that. And then you go back and you look to say, hey, did they develop antibodies? So particularly with Lyme, if we see the characteristic rash, we just treat. The recommendation is to not even test because you may not subsequently develop an antibody response because you've been treated. So there are PCRs. So I think our audience is probably more familiar with PCRs these days than they would have been a couple of years ago.
Right.
But there are PCRs. They're available really from commercial labs, and their sensitivity is not so great, and they also are not all that accurate. So I think that that's an area where there's a lot of room for improvement in terms of development of diagnostic tests.
So we've talked about diagnosis, we've talked about treatment. I want to take us back to the beginning and talk a little bit about prevention. We talked at the very beginning that these ticks that carry these various diseases are mighty small. So one can imagine that you're not even aware that you've been exposed or bitten. So what's your advice to people who want to be outside in the summertime, who might be in an area where there are ticks? How do you prevent getting bit, and how do you prevent getting sick if you have been bitten?
So there's some basic things about clothing and where you tread. So the first thing is that it's helpful to wear light colored clothing so that you can see the ticks against them, because they tend to be dark brown to black in color, and to wear long pants, to wear socks, to tuck the pants into the socks, again, so that you can see things like that. To stay out of high grass, to stay in the center of paths as you go hiking, et cetera, to try to reduce the exposure somewhat. So that those are some of the things. So there are also, all right, so people want to believe that mosquito repellents will repel ticks, and they do. So DEET has some repellent activity, but it doesn't kill ticks, and it's only a partial repellent. But there's something called permethrin that can be used to treat clothing or gear that actually kills the ticks. And so that's helpful for that. So you can either buy things that are coated with permethrin or treat them yourself. But I wouldn't just do that without, looking further in terms of how to do the treatment. And then I guess, so we talked earlier about tick checks for people and pets. And then there comes to the question of prophylaxis.
Well, before you get to prophylaxis, say a little bit more about tick checks. If I go for a hike in the woods, or somebody's taking their kids for an outing in the countryside, what should they actually do?
So part of the recommendation actually also is to shower within 2 hours after you come inside. You want to look at, sort of along the hairline, behind the knees, in the different creases of the body, and just look at the skin to see if you identify any ticks. And then in terms of tick removal, what do you do if you find a tick? So it's recommended that you take a fine-tooth tweezer and a clean fine-tooth tweezer and grab the tick as close as you can to the mouth, and gently
of the tick.
Yeah, and gently and firmly pull back. Okay, so no twisting, no jerking, none of that, because you don't want to leave the tick's mouth attached to the skin. There's some folklore also about burning ticks off, etc. None of those are a good idea. Not that, not putting like petroleum on or any of that. Just stay away from that. It's all really just remove the tick with the tweezers and with fine motion backwards.
And if you do that, you do it within hours of the time you were bitten, you're generally in pretty good shape.
Yes.
Okay. Well, look, I think this has been fascinating. Any resources that you would recommend to our listeners who want to learn more about these illnesses and the subjects we've talked about today?
Sure. So the CDC has a wonderful website on tick-borne diseases. It really does. I think people are more familiar with the CDC website and using it now since COVID. They have a really terrific site. The other thing that's sort of a good resource for some of the more practical aspects of this, of tick and disease prevention, is the Infectious Diseases Society of America has a website, and they have guidelines. A lot of it is in medicalese. Some of the more practical means of prevention are very well discussed there. So I think those are the two that I'd recommend most.
Great. Any final parting thoughts about tick-borne illnesses?
Yeah, I just want to go back to the idea of pay attention to your body, particularly in the era of COVID when people sort of get weird fevers and don't know what they're from, particularly if you've been in a park, you've been outside or doing anything. Think about tick-borne diseases and don't ignore it.
Okay, well, let's leave it there. Thank you so much.
Thank you.
My guest has been Dr. Marta Feldmesser. She is the Chief of Infectious Diseases at Lenox Hill Hospital in New York. For more information about this program and to find past episodes, please visit medicine.hofstra.edu/wellsaid. You can also subscribe to our free podcast wherever you get your podcasts. Our listeners are also welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.